Hello again.
Hello, how are you?
I'm good.
Thank you.
So, in your practice, did you treat some people with irritable bowel syndrome?
Yes, irritable bowel is a common problem, um, and that's a condition where people's bowel pattern changes, and you can get discomfort. You just don't feel normal, and with the change of bowel pattern, it is putting stress on your daily life. And to treat IBS, one, after you make the proper diagnosis, in medicine we have a number of medications we use. Again, it doesn't work for everybody, but some people can have a benefit. But it's interesting that the Mayo Clinic looked at a large group of patients and they used acupuncture. And they found, and the study lasted 12 weeks, so it's 3 months,
Yes.
that these patients did better than many of the patients on the medication. So acupuncture somehow was able to look at the underlying cause or treat the underlying cause in a far easier way, because side effects from acupuncture, other than maybe a tiny little bit of discomfort if you have that, don't exist, unlike any medication. I mean, I can give a patient a medication that they've never had before and they get an allergic reaction. Medications cause headaches, upset stomach. They actually can change your bowel pattern. There are many side effects. And if somebody's already on one medicine and I give them a second, there's always a possibility that the two medicines can interact.
That's right.
But if you use acupuncture, there's no interaction with whatever I'm on. So if I'm being treated for blood pressure or cholesterol or diabetes or any of the common conditions in our society, and I happen to have IBS, and I start to use acupuncture, I don't have to worry about the medicines I'm currently on, that I have to make an adjustment, it could affect them. And again, like anything else, you can combine acupuncture for a patient who has IBS and perhaps make the treatment more effective.
Yes, and then you said sometimes they compare the sham acupuncture and real acupuncture.
Right.
Yeah.
Yeah. In any study, what you do, you want to know that the treatment you're looking at is a real treatment. So if I'm looking at a new medication, say for IBS, we take a group of patients, let's say 1,000 patients, you want to take enough patients, 500 of them get a sugar-like pill, no effect, and 500 get the pill that we're studying. Well, if you move that to acupuncture, of the 1,000 patients, 500 have a skilled acupuncturist who's trained, who does acupuncture for whatever the condition is, IBS, or it could be migraine or whatever. The other 500 have somebody come in. They don't know that that person is not giving them, quote, proper or real acupuncture. In their mind, they're receiving a treatment, which is acupuncture. And the people before the study know that there's a 50-50 chance that they will be getting the real or the sham. But then at the end of the study, when they look at the results, they can clearly see, for IBS or for other conditions, that real acupuncture had a positive effect, and the sham acupuncture was the same as doing nothing. It didn't benefit the patient. But that makes it a much better study than just using acupuncture alone and comparing it to, say, a drug. You get it's a more scientific study.
Yes.
And there are these studies for acupuncture, which are, important to know when you're looking for any treatment. Was the study done properly, and who did it? And the Mayo Clinic did a study for IBS. So if you're dealing with a major in American research healthcare provider, you've got good information.
Yes, I think Mayo Clinic is very, very
good. Mayo Clinic, Cleveland Clinic, Johns Hopkins, Harvard, all these centers, and there are others in our country, of course. I don't want to ignore any, do rigorous scientific work, and we as patients benefit, and as providers, that's how I know what I should choose and offer the patient. And even though I can't do acupuncture, I can say to the patient, here is a method that has been successful. And again, we're talking IBS, but it could be migraine, dizziness or vertigo. There are some cases that can definitely be treated by that. And then you give the patient the broadest choice of choices.
Yes, and then you read a lot, like Journal of New England Journal of Medicine. That's give a lot of research.
Oh,
right?
yeah, New England Journal of Medicine has been around for hundreds of years. It's worldwide recognized as a top medical journal, like the British Medical Journal and some other journals, where before something is published, the staff do a rigorous review of what the researchers have presented, and to make sure that they're giving appropriate, accurate information to their readers, because I've been getting the journal for 40 years, and that is one of my best sources of knowing what do I do for a patient. And because medicine is changing,
That's right.
as I'm sure acupuncture is, as you get more knowledge, I learned where to make changes. So the treatment that I would have done for IBS many years ago is going to be different now, as it goes for migraine or blood pressure or any of our conditions that we treat on a regular basis.
That's right. So we based our treatment on those kind of a very very solid journal.
Very solid, and very very well respected. If an article comes out of the journal, you know it's important. They're not going to publish some studies. There are multitude of journals around the world, and some of the information is nice to know, and it may make a little difference. But if there's a major study, those authors would want to have it published in British Medical Journal, New England Journal of Medicine, or Mayo Clinic Proceedings, for example. These are the top journals in our country and worldwide.
Yes,